Good afternoon, everyone, and welcome to today's program, Medical Librarians Supporting Pharmacists. And we're so glad that you're here joining us today. Before we begin, I have a few housekeeping items. I am Christine Brown, the Outreach Services Librarian for the South Central Regional Library Council. My pronouns are she, her. The South Central Regional Library Council is one of 9 multi-type library systems comprising the Empire State Library Network in New York State. SCRLC covers 14 counties, 10,045 square miles, and is headquartered in Ithaca, New York. A few additional items, if you have not already found it, closed captioning is available by clicking on the show caption on your taskbar, and you do have language options as well. Throughout the presentation, you're welcome to type questions and comments via the chat feature, and we will have some opportunities for discussion after the presentation. If you'd like everyone to see your questions and comments, make sure to select everyone in the drop-down menu of the chat box. The webinar today is being recorded and it will be shared with all registrants along with information about how to request a certificate of attendance. And there will also be a link to the evaluation form, and that will be added to the chat near the end of the presentation. We ask that you follow SCRLC's Code of Conduct, and we will add a link to that in the chat box shortly. The Cliff Notes version is be kind, be courteous, and be respectful. We also hope that you'll be totally engaged in the program as well. I also want to remind everyone of the benefits of the HLSP program. First, there is the grant program that provides funds to support collection development, improve technology, and provide library services. Through the HLSP program, we provide free and discounted access to biomedical resources, including the New England Journal of Medicine and selected Ovid e-journals, along with some StatRef titles. We also have document delivery services support through DocLine, and its EFTS is another benefit that we provide. We have a newsletter for the HLSP members, and we provide continuing educational opportunities such as what we're doing today. And now I will introduce Nada. Nada Gilman is an associate librarian at the Binghamton University in Binghamton, New York. She is the assistant head of sustainability and STEM engagement, co-founder of the Sustainability Hub, and librarian for the School of Pharmacy and Pharmaceutical Sciences and Departments of Physical Therapy, Occupational Therapy, Speech, Language, and Pathology, and Environmental Studies. She has a BS in Medical Laboratory Science from the University of Utah and an MLS from the University at Buffalo. And now I will turn it over to Nada. Thank you for being here today, Nada.
Thank you. Let me get my screen up. All right. Move you over there. Okay. Okay, there we go. So thank you for having me. I'm hoping that this will be, we'll have a little bit of a discussion at the end. But my name is Nada. As you heard, I'm the pharmacy librarian at Binghamton University in Binghamton, New York. And there's my email. So if anybody wants to reach out and discuss pharmacy librarianship, please do. I'd love to chat. Okay. So what I was hoping we could talk about today is I basically want to give an overview of my experience working with pharmacists in 3 different stages. So information mastery, pharmacists as providers, and then talking about the resources that I think that they use most heavily. Talk a little bit about how I think that you would be able to support the pharmacists in your lives, whether it's through a hospital system or an academic library. And then I'm, again, hoping that we can have a bit of a discussion to hear about what your interactions are and what challenges you might be facing with working with the pharmacist. Okay, so to start, information mastery. Information mastery is, the quick version is I always say that information mastery is what pharmacists call information literacy. There is a bit of difference, but one of the things that I was most surprised about, I started here 9 years ago now, before the school opened, to work with the school as it was opening to get the resources they needed. And my previous career in librarianship, I worked with a variety of different academics. I came from working in a hospital, not in the library, but my previous career was working in a hospital. So I interacted with a lot of healthcare providers. And I was so surprised when I started working with the pharmacist here about how information literate they were. Like their level of need was higher than I was used to in when working with faculty, in that they already understood the basics. They already had a strong grasp of information literacy. So information mastery from the 90s started at Tufts. It's like I said, it's basically information literacy, but one of the things I find interesting about it is it really takes into account the time, effort, and money required to access information, which I think is part of information literacy generally as well. But I found it really interesting that it's kind of a core part of information mastery. But this is there for you to read. You can also just Google information mastery and find more information about it. It is something that every pharmacist I've talked to has been part of their training. This is a slide that I just stole from the slides that I provide to the first year pharmacists when I give I have like a 2-hour class that I have with them. And this is one of the first slides I show in that class because it has been emphasized to me just through my work with the pharmacist about how important information literacy and information mastery is to the pharmacist. So I want to get that started with the students first thing, both in regards to like the whole spectrum of information literacy, from the communication sides to it to the evidence-based medicine side of it. Okay, so that was a very brief introduction to how information literate pharmacists are. The other important part that I think a lot of people don't recognize, or at least I didn't when I first started working with pharmacists, when I first, before I started here, my primary thought of pharmacists was I go to the pharmacist, I go to CVS, I go to Wegmans, I go to Walgreens, whatever, and ask for my medications and they give it to me and I walk away. Sometimes you have the opportunity to talk to the pharmacist there, but I never really did that. I never really thought much about it. But through my time here, I'm again really beginning to see pharmacists in a different light in that they are healthcare providers. They have a lot of education, they have a lot of experience, and they are there providing care for patients out in the community. So to get to that, I want to talk a little bit about how pharmacy, how the School of Pharmacy and Pharmaceutical Sciences here at Binghamton works. Obviously, every institution is going to be a little bit different, but I think this is pretty common. We have 2 departments within the school. There used to be 3, but it got merged down to 2, I don't know, a few years ago, maybe 5 years ago or so. But there's one, the pharmaceutical sciences. They are the ones that bring in a lot of the money. They bring in a lot of the funding. They're doing in the expensive labs, they're doing that drug discovery, genomics, chemistry type of research. And then there's the clinical pharmacists, which are in the pharmacy practice department. And they are much more focused on the therapeutic benefits of working with the community, the clinical type of research. They have the practice lab up for the students to practice actually being in a pharmacy distributing drugs, or the practice living room so they can practice going to a patient's house and talking to the patients there. And down at the bottom, I've been tracking the schools, the faculty publications since about 2018, I want to say, maybe 2019. And I found it really interesting that the pharmaceutical sciences and the pharmacy practice groups, there's some overlap. Sometimes they do their research together, but a lot of times it's pretty different type of work. They are both groups of faculty are doing a lot of research. They both have different information needs, but they're both doing research. They're both putting a lot of publications out there. And there you can see that the PharmSci group has more publications, but I would not be surprised in the next few years if the Pharm Practice group ends up with more publications. When the school first opened, the dean at the time really emphasized the PharmSci group doing the research and the Pharm Practice group not doing so much research, not being research heavy. That has changed with a new dean and just with a new structuring. So they have had the opportunity to put more research out there. And I think as time goes on, they will potentially pass the PharmSci group. Maybe it's different types of research, but I've been really kind of surprised at how much they are doing and how much they are putting out there. Again, disclaimer, I don't know if I said this at the beginning, I'm in an academic institution. I realize that my interactions with the pharmacists are going to be different than those who are working on site or at the hospitals. But also a lot of my faculty here are also working in CVS at Wegmans. They're doing that clinical work as well. So there is some overlap. And the students that we train here are going out into the world and will be the ones working at the hospitals and et cetera. Okay. Speaking of the students, there are 3 programs that our students can go through. The main one is the PharmD. That is the primary degree that we've had since we've opened. That's the primary one that the students go through. I meant to look up the numbers and I didn't get a chance to. The PharmD combo with the MBA, I found really interesting, that combination. And then the PhD, 3 years, maybe 4 years. Those are not as, they're newer than the general PharmD, but it kind of shows you the different tracks that students can take. And I would argue that the PharmD and the PhD are probably some of those more hard science-y, chemistry-focused types of research. And then the PharmD students are usually, not always, but I would say usually more interested in that clinical side of things. Okay. This is a messy slide. Sorry about that, but I just wanted to kind of put a bunch of information out there to emphasize with all of that, the different tracks that the pharmacists do. They are healthcare providers. And I'm emphasizing this because there is a little bit of pushback from some other healthcare providers. And I think there's a lack of understanding about really what pharmacists can do. So just to show you, this infographic is from the American Pharmacists Association. Again, you could probably Google it and get a better view of it if you'd like. Basically, all of the pharmacy organizations promote pharmacists as providers. And there is some research out there. I just took 2 and put them in here, talking about the benefits of pharmacists as healthcare providers. I'm learning that New York State is a little bit behind on this. They don't give the pharmacists in New York State as much responsibilities as other healthcare providers that other states do. So that is something that a lot of the pharmacists here have been working towards, to try to get more of that the capability to actually act as the healthcare providers that they are. Okay, so covering some of the resources that I think are going to be most useful for pharmacists. And again, these are the pharmacists that I deal with in an academic institution, but I think it branches out. So for literature searching, I kind of broke it down into 4 basic types of resources that the pharmacists are using. When they're doing literature searching, it's PubMed. It just is. That's what they use. It's PubMed, PubMed, PubMed. That is Sometimes I can get them to use Web of Science or Embase. Um, Web of Science probably more than Embase, but PubMed is where they're going to go first and foremost. And branching out of that there'd have to be a reason for them to really want to go beyond PubMed. I'm not saying that they're experts at searching PubMed, but that is what they use, and they're in there all the time. Trip, if you're not familiar with it, is a free resource that searches a lot of things in PubMed and other resources. And I found that my pharmacists really enjoyed that database as well. The point of care, we are lucky here to have both UpToDate and Dynamed. Their preference is almost always for UpToDate. And I think that is because I believe that is what most of the hospital systems in the area use. And so that is what they are used to, and that is what they are training the students to use. However, it was also a pharmacist that asked me to try to get Dynamed to the libraries. So that is why we have it, is because the pharmacists were asking for it. Jumping down to the drug databases, this might be the one that is not, or that are not as familiar to people who are not regularly working with pharmacists, but you probably know the names. LexiDrug and Facts and Comparison are basically the same thing now. Facts and Comparisons are absorbed into LexiDrug, but people still refer to both. And then Micromedics. And the thing with the point of care resources and the drug resources, they are also tied together. So UpToDate and LexiDrug are linked. Dynamed and Micromedics are linked. Redbook is accessible through Micromedics. Redbook is a resource for infectious diseases. So they're getting more and more just into one giant resource. And then chemistry. Chemistry is actually probably the area that I am least familiar with, which is something that I need to work on. But a lot of those pharm sci faculty or pharmacists are using these chemistry resources for their drug development, and the students are learning them as well. So I would say, generally speaking, these are the databases that are most frequently used by the pharmacists that I interact with. Other resources, those journals are probably the ones that I get the most questions about, the most needs about. The first two are through pharmacy organizations. Lactation resources, I was really surprised about this too, that the request or the needs for these different types of resources. Health Med, we don't have anymore, but it was originally requested for the pharmacist. LactMed is through NIH, and then Briggs is another database that is integrated again into LexiDrug. But those are resources that I haven't been asked about by any other healthcare providers or students or faculty, but the pharmacists, I'm regularly getting emails or questions about those types of things. And then Access Pharmacy and Pharmacy Library are just heavily used here. Again, academic, it's what the students are using for their books. It's what the teachers are using to help guide their classes. So those are two resources that the students here and the faculty here are going to be very familiar with. The things in the bottoms are the things that I've had, obviously not, well, I guess Zotero might be considered a resource, but I see these as the needs that the pharmacists are coming to me with. Well, I wish they were coming to me with systematic review needs. They are very information literate. They are very skilled at searching, but I still see gaps in regards to a lot of that, especially when I see systematic reviews. So that is a gap that eventually Laura and I can work together and fill that, because there are systematic reviews being done out there that are they're probably not the best, but it is something that they utilize and want to participate in. Zotero and other citation managers, again, I was somewhat surprised at how frequently they were bringing it up. Zotero, I think, is the one that most of the pharmacists here use. Some of them I've worked with them with EndNote. I use EndNote, but that may be something else to be aware of. And then I have had so many pharmacists wanting assistance in regards to open access publishing. This, again, this is probably the academic side of things, but they are really into the open access publishing. Obviously, I think the NIH stuff has a lot to do with it, but I'm not getting the same requests from other healthcare providers. Okay. So I was specifically asked about if the pharmacists are using AI. And I'm going to say that I am not the best source on this right now because I try to avoid AI to a certain extent. But I do know that in the classes here, it is frowned upon. I think it's used in certain aspects, but they really do try to get the students to not rely on it. I'm not sure how successful they are on that. I have had some success or some positive interactions with AI and the pharmacist around open medicine. Is that what it's called? I'm blanking on the name of it right now. I think that's the one that I'm thinking of. But it's something that it's affecting everybody. It's affecting all of us in regards to the classes. But I'm actually was really hoping that this could be part of the discussion that we have is if you have interacted with healthcare providers in general and their use of AI. Okay. Looking at my list, my notes. Okay, so taken all of that brief overview of pharmacists and my experience with them, how do I think, in my person as an academic, my academic experience, medical librarians can support pharmacists? And it's basically what I was just talking about. Remember that the pharmacists are healthcare providers. Most of them see themselves that way. They have years of training. They work with everybody from the general public to MDs to NPs to physical therapists, everybody else in the healthcare field. They are they should be used to communicating with those varieties of people. And then they have a huge range of their information needs. It all depends on if the pharmacist you're working with is the community pharmacist or if it's the drug developing pharmacist or if it's whatever they are focused on. And that I think kind of makes it exciting, but it also can be a bit overwhelming because there's so many resources out there that depending on what they're actually needing and what they're actually interested in as a pharmacist is going to make a difference. And I think that's true for a lot of things, but I found it kind of emphasized in regards to pharmacists. And then I just wanted to note that if anybody is working with Binghamton students, pharmacy students in any of the hospitals or anywhere, they should be learning all of that. So, encourage that with them, encourage them to practice their different communication skills. They should be learning information mastery, all of those types of things. They might need help getting away from I would say those three, PubMed, LexiDrug, I guess I could add UpToDate and Access Pharmacy. Those are the first places they go. And it can be hard, especially for the students. The faculty, are more experienced and they do what they need to do. But it can be really hard to get the students to try something different. So, okay. So, again, what I think that those of us working with pharmacists can do is, again, figure out exactly maybe not exactly, but where those general themes are in regards to the research interest and prioritize those resources that can benefit them in that way. Provide advanced PubMed searching techniques. Again, they all use PubMed heavily, and they will all probably say that they are expert PubMed searches, but I think we all can relate that there's things that we could guide them through. So I think showing them some of those advanced PubMed searching techniques could be really beneficial. I put a question mark here because I'm, again, academic. transformative agreements have been really big here in regards to helping them publish open access. The pharmacists in the hospital, they're probably not publishing as much. They're probably needing more than they are publishing. So that might not be as beneficial to them, but it is something that is being heavily discussed up here. And then highlighting the free resources such as TRIP and LactMed. They are probably familiar with them. They are pretty good at finding the resources that they need to find the information that they need, but it couldn't hurt to promote them a little bit to make sure that they are aware, especially if you're someplace that the paid resources are scarce. The citation managers, again, I was somewhat surprised by this, but they seem to really, I almost said enjoy them, but I mean, I sometimes enjoy citation managers, but they utilize them heavily. Again, the faculty that I work with. And then the biggest thing is to see them as healthcare providers, to recognize that they are healthcare providers and support them in that way. That is I think, the core of what I see the pharmacists I work with needing and wanting out of their interactions. And then what else? I'm not sure with everything that I've talked about, with your individual interactions, what you think might be helpful for them. And that is where I'm at, is to see if you have any questions and to hear from any of you about your interactions with pharmacists.
And I think with the small size we have today,
Yeah.
if anybody has any questions, you can jump in. You don't need to limit it to the chat, although if you're more comfortable with chat, feel free to use that as well. But please, you can unmute yourself and ask any questions you might have. Or share any comments or thoughts about what you've experienced as well. And I think the AI that you were talking about is open
It is
evidence.
open. Yeah.
Yeah.
That is the one.
Yeah, that is the one. I have not used it. I've been involved in some online discussions about it. So there are limitations with it, and
Yeah.
from what I've heard, they don't seem to want to work with the librarians so much. So,
Oh, I
um,
haven't heard that. Okay.
yeah, I've heard several complaints of people saying that they've reached out to Open Evidence to try to get an account set up because their hospital or uh, university that they're working with has it. It's mostly hospitals, and they just don't get any response from the people at Open Evidence.
Okay.
So that's been kind of a surprise, and the librarians are trying to get a workaround so that they can use it and see how what it is. But yeah, there's been some issues that I've read about, so that's an interesting part of it. So
Yeah.
I was interested that you haven't really seen a lot of people using AI there so much. So
I really haven't. Maybe I'm just not looking hard enough. Maybe they're hiding it from me. I don't know. But when I talk to the faculty here, they don't seem to be really into it. Of course, everybody is like exploring it and aware of it, but I haven't run into anybody that is heavily like, I just had a brain moment where I think there was one student who was talking about it, but I don't think that was a pharmacy student. Um, I haven't interacted with anybody that was, all I'm using is AI, and we need to get all the AI things because we
mhm.
don't have, I'm trying to think of the resources that we have that have an AI option with them. We trialed Web of Science. But we don't have it yet. We have Primo as our LMS, but we don't have it turned on in there. And nobody's really asking for it, at least that I've heard.
Okay. Does anyone have any questions, comments, or thoughts they want to share?
Only
I think it's really, oh, go ahead, Claire. Yeah.
this is totally tangential. My sister works, she used to work at Evidera, but that was bought out by Thermo Fisher. And this is a company that pharmaceutical companies pay to like take the scientific materials and make it market ready so that like the United States government and then the European markets will approve the drugs for use and insurances will cover it. So she has a degree in pharmaceuticals or something. I don't remember. Anyways, we were talking about AI, and she said that her company, which makes sense, it's a corporate company, absolutely requires all of their employees to make use of AI, to use AI at every turn, which I mean will it will filter its
Mm.
way up to your students and your pharmacists who rely on that kind of information, which is now being, I mean, there are still obviously humans like my sister who are looking through what the AI would produce, but it's kind of gross.
Yeah, I guess I'm not surprised to hear that. I'm disappointed to hear it, but I am not surprised. But I'll have to keep my eye out for it making its way here.
This was excellent, though. Thank you. I mean, it's not super, I don't work with the pharmacy students, but it was really nice to hear all of that.
Yeah, I have some familiarity with the pharmacists. I think people tend to not view pharmacists as healthcare providers because we see them at the CVS and other
Yep.
retail settings, and so that kind of impacts the view. But yeah, they're definitely there. Mm. Does anybody else have any questions, comments, thoughts?
Maybe just a comment. I've not worked in a teaching hospital for decades and decades and decades, but we had a really good relationship with the pharmacy. And one way that I don't recall doing a lot of literature searches for them back in the days when we did mediated searches for healthcare professionals. But one thing that really came in handy, we would get scribbles often from the residents and physicians, and the pharmacy at that hospital had a book that translated signatures into which physician it was. So we were often down at the pharmacy decoding like that back in the day. Oh, they were very
That's
helpful.
funny. I love that. Mm.
So, is there any training they get on reading those things? How does that go?
Mm.
Do we have any other questions, comments, or thoughts? Okay, I have shared the evaluation form in the chat, so if you are able to, please join that. And otherwise, we will end our program for today. And I thank all of you for being here. I thank you, Nada, for this excellent program. I learned a lot, so
Oh,
thanks.
thanks. Thanks.
And I will see everyone.
Sounds good. Bye.
Bye bye.